Hi everyone, my name is Ilani Jaimes. I have been a dental assistant for the past 10 years. I have been working side by side with both dentists, dental hygienists, and the front office staff that deals with billing. I have also helped my community via health fairs. After all of this, I had come to the conclusion of why people struggle with dental health care. The number one reason that I think people struggle with dental health care is education. According to the American Dental Association, tooth loss can occur for a number of reasons. It can be decay or it can be injury. The most common reason for tooth loss is periodontal disease. What is periodontal disease? So, this disease is disease of the gums. We prevent periodontal disease by having good dental hygiene. This includes properly brushing your teeth with a toothbrush that has soft bristles, using the toothpaste of your choice as long as it includes fluoride, and flossing. Yes, flossing is the most important thing that you can do. If you've noticed that when you're brushing, you are bleeding from your gums, that's because you're not flossing, or at least you're not doing it properly. If you are noticing that you are bleeding while flossing, that means that you're not doing it as regularly as you should. So why is flossing so important? Although you may brush very well and even use mouthwash, you are still not getting that bacteria and buildup that can be building up in between your teeth. Toothbrush bristles are too big to clean in between your teeth and help break out bacteria. So after this bacteria has been sitting in your teeth for a while, it starts to cause problems. It starts to cause inflammation. The gums tend to turn kind of like a vibrant red instead of a healthy pink, and you occasionally bleed. This bacteria sticks to your teeth and starts to secrete acids. These acids start to eat up the enamel, which is your tooth. So cavities that start in between your teeth are kind of like a double whammy. Because of their location, the dentist can only diagnose and pretty much see them with x-rays called bite wings. And because they started in between your teeth, instead of having one cavity, you have two, because one started on the front side and one started on the other side of two different teeth. So the reason why I say that the number one reason why people don't have as good as dental health as they should is because education. I constantly see patients wait till they have a toothache or an abscess to come to the dentist. These patients tend to not come in for regular cleanings and checkups, which I understand that they can run about $135 if you do not have insurance. But now let me tell you how much a root canal would cost. So after decay has been sitting in there for a little while, and you maybe break a little piece of your tooth and it's not bothering, or finally it just starts to kill you, you probably go to the dentist and they'll give you two options. We can either pull the tooth, which nobody really wants to do, or we can save the tooth performing a root canal, where the dentist removes the tissue inside your tooth, therefore killing the bacteria that started in there. The average cost of a root canal is about $800, and that's if you go to a general dentist. If you kind of have funky roots and you have to go to a specialist, or your tooth has been extremely infected and you can't get into the canals, then you do have to be referred to a endodontist, which is a specialist of root canals, and that can cost an average of $1,200 for a root canal on a molar, which are the most common teeth that root canals are performed. Now that a root canal has been performed, it is recommended to put a crown on that tooth to help protect it. So like I said, a root canal is when they drill a hole and remove the decay and take away the infection. By taking away the infection, they remove tissue where the infection's at, but that also means that they're removing the blood supply of the tooth, therefore making the tooth brittle and susceptible to cracks and fractures. A crown averages about $700, so now you have wasted $1,500 on a tooth, where you could have probably just avoided all this by going and getting your teeth cleaned and checked, and a dentist could have diagnosed a cavity or two, and usually cavities run about $150, so you're thinking about maybe $300 for getting a cleaning and getting a filling done, instead of $1,500 for getting a root canal and also crowning a tooth, and that's one tooth instead of getting your whole mouth cleaned and your whole mouth checked. I can understand why people or patients believe that something is not worth spending money on or getting it checked if it's not bothering. But if you let that little cavity turn into something bigger, and it's going to cost more money to get it fixed. Right now, you can go to your local grocery store and spend $4 worth of floss that will last you about half a year. Flossing regularly prevents about 80% of cavities, yet 7 out of 10 people do not floss regularly.